Hello everyone, and welcome to our NCLEX-RN medical terms series. In this lesson, we're going to focus on one of the most fundamental areas of nursing practice: nursing assessment. We will learn how to distinguish between subjective and objective data, and we will review the 4 basic physical examination techniques: inspection, palpation, percussion, and auscultation. But this lesson is not just about memorizing medical terminology. For the NCLEX-RN, you need to understand what each term means, what it looks like in a real patient, and, most importantly, how that information affects your nursing decision. So throughout this lesson, think about this sequence: term, meaning, patient finding, nursing significance, priority, and NCLEX-RN application. Let's get started. By the end of this lesson, you should be able to accomplish 5 things. First, you should be able to differentiate subjective data from objective data. Second, you should recognize the 4 primary physical examination techniques. Third, you should know the normal sequence of a physical assessment and remember the important exception for the abdominal assessment. Fourth, you should recognize common NCLEX-RN clues that tell you whether the question is describing a symptom, an assessment finding, or a priority nursing action. And finally, you should be able to use assessment data to make safe clinical judgments. Remember, NCLEX-RN questions do not simply test whether you know a definition. They test whether you can use that information to make the safest nursing decision. Let's begin with 2 very important terms: subjective data and objective data. Subjective data is information that comes from the patient. These are the patient's feelings, perceptions, experiences, and symptoms. For example, if your patient says, "I feel dizzy," that is subjective data. You cannot directly measure the patient's feeling of dizziness. You know about it because the patient reported it. On the NCLEX-RN, watch for words such as reports, states, describes, complains of, or feels. A simple memory trick is S for subjective, S for spoken by the patient. Now let's compare that with objective data. Objective data is information that the nurse can observe, measure, or verify. Examples include blood pressure, heart rate, oxygen saturation, laboratory values, edema, skin color, and physical examination findings. For example, a heart rate of 118 beats per minute is objective because you can measure it. The memory trick is O for objective, O for observed. So remember, subjective is what the patient tells you. Objective is what you observe or measure. Let's practice. The patient says, "I feel like my heart is racing." Is this subjective or objective? It is subjective because the patient is describing a sensation. Now suppose you check the patient's pulse and the heart rate is 118 beats per minute. That is objective because you measured it. Here's another example. The patient says, "My shoes feel tighter today." That's subjective. But when you examine the legs, you find 2+ bilateral pitting edema. That's objective. And finally, the patient says, "My stomach has been cramping for 3 hours." The abdominal pain or cramping is subjective. However, if you observe the patient guarding the abdomen and grimacing, those are objective findings because you can see them. This distinction is very important for NCLEX-RN questions. Think, what did the patient tell me, and what did the nurse actually observe or measure? Now let's move into the 4 basic physical examination techniques. There are 4 terms you need to know: inspection, palpation, percussion, auscultation. Here's the easiest way to remember them. Inspection means look, palpation means touch, percussion means tap, and auscultation means listen. These 4 terms appear frequently in nursing questions, so you should immediately recognize the action associated with each one. Let's look at them individually. The first technique is inspection. Inspection means performing a deliberate and systematic visual examination of the patient. In simple language, inspection means look. But inspection is more than casually looking at your patient. You are deliberately observing things such as symmetry, skin color, body position, movement, respiratory effort, and overall appearance. And here's an important clinical point. Your inspection begins the moment you see the patient. Before you touch the patient, you may already notice whether the patient is alert, pale, diaphoretic, cyanotic, anxious, or struggling to breathe. For example, during a respiratory assessment, you might inspect the chest for symmetrical expansion and accessory muscle use. Some important red flags include cyanosis, asymmetric chest movement, or severe increased work of breathing. On the NCLEX-RN, phrases such as, "the nurse observes," or, "the nurse notes the appearance," usually indicate inspection. So remember, inspection equals look. The second technique is palpation. Palpation means using your hands and fingers to examine the patient. In simple language, palpation equals touch. Palpation allows the nurse to assess characteristics such as temperature, texture, moisture, pulses, tenderness, and masses. Different parts of your hand can provide different information. The finger pads are useful for assessing pulses and detecting subtle differences in texture. The back, or dorsum, of the hand is useful when comparing skin temperature. For example, if you document, "the abdomen is soft and non-tender to palpation," you obtained that information by touching the abdomen. Be alert for significant abnormal findings. A rigid or board-like abdomen, especially when associated with severe pain or tenderness, can indicate a serious abdominal condition and requires prompt evaluation. On the NCLEX-RN, look for phrases such as, "the nurse feels," or, "on palpation." Remember, palpation equals touch. The third technique is percussion. Percussion means tapping on the body surface and listening to the sound that is produced. The sound gives us information about the density of the tissue underneath. There are several percussion sounds, but let's focus on 3 important ones. First is resonance. Resonance is a relatively hollow sound expected over normal lung tissue. Second is timpani. Timpani is a drum-like sound typically heard over an air-filled structure, such as the stomach. Third is dullness. Dullness is heard over dense or solid tissue, such as the liver, and may also occur over areas containing fluid. For example, a distended bladder may produce dullness to percussion. For NCLEX-RN purposes, if the question says, "the nurse taps the patient's chest," you should immediately think, percussion. So, percussion equals tap. The fourth technique is auscultation. Auscultation means listening to sounds produced by the body, usually with a stethoscope. In simple terms, auscultation equals listen. We use auscultation to evaluate heart sounds, lung sounds, vascular sounds, and bowel sounds. When listening, the nurse may assess characteristics such as frequency, intensity, duration, rhythm, and quality. Whenever possible, place the stethoscope directly against the patient's skin because clothing can create friction or artifact. One particularly important red flag is stridor. Stridor is a high-pitched airway sound that can indicate upper airway obstruction. Because airway obstruction can become life-threatening, stridor requires urgent attention. On NCLEX-RN questions, phrases such as, "the nurse hears," or, "on auscultation," tell you that the nurse is listening. Remember, auscultation equals listen. Now we come to a very important NCLEX-RN concept, the order of physical assessment. For a general physical assessment, the traditional sequence is inspection, palpation, percussion, and auscultation, or IPPA. But there is an important exception. For the abdomen, the sequence is inspection, auscultation, percussion, and palpation. That's IAPP. Why is the abdomen different? Because percussion and palpation can stimulate bowel activity. If you palpate or percuss first, you may alter the bowel sounds you are trying to assess. Therefore, you listen to bowel sounds before percussion and palpation. This is a classic nursing test concept. Remember, general assessment IPPA, abdomen IAPP. Now let's talk about one of the most important NCLEX-RN strategies. Should you assess before you intervene? Many students memorize the rule. Always assess first, but be careful. That rule is not absolute. If a stable patient develops a new symptom, assessment often comes before intervention because you need more information. For example, suppose a patient develops new shortness of breath. You may quickly assess the patient's work of breathing, oxygen saturation, respiratory rate, and lung sounds. But if the patient is experiencing an obvious life-threatening emergency, you should not delay a life-saving intervention simply because you want more assessment data. Think about immediate threats to airway, breathing, circulation, neurologic status, and safety. The NCLEX-RN is testing clinical judgment, not just memorized rules. So instead of asking, "Do I always assess first?" ask yourself, "Is this patient stable enough for further assessment, or is immediate action required?" Now let's apply what we've learned. Here's your NCLEX-RN practice question. A nurse is performing an admission assessment on a client with suspected heart failure. Which finding should the nurse document as objective data? Option A. The client reports feeling short of breath while walking. Option B. The client states, "My shoes feel tighter than yesterday." Option C. The nurse notes 2+ pitting edema in both lower extremities. Option D. The client describes a heavy feeling in the chest. Take a moment and choose your answer. Remember our rule. Subjective is what the patient tells you. Objective is what the nurse observes or measures. Now let's look at the answer. The correct answer is C2+ bilateral pitting edema. Why? Because edema can be directly observed and assessed by the nurse. That makes it objective data. Let's look at the incorrect answers. Option A is subjective because the patient reports shortness of breath. The medical term for shortness of breath is dyspnea, but when the patient reports feeling short of breath, that symptom is subjective. Option B is also subjective. The patient says that the shoes feel tighter. That's the patient's perception. Option D is subjective because a heavy feeling in the chest is a sensation described by the patient. Here's your NCLEX-RN takeaway. Signs are generally objective. Symptoms reported by the patient are subjective. And remember our memory trick. S equals spoken. O equals observed. Let's put everything together with a short clinical case. Your patient says, "My stomach has been cramping for 3 hours." First, identify the type of data. The cramping is subjective because the patient reported it. Now begin your physical assessment. First, inspection. Observe the abdomen for distension, scars, asymmetry, guarding, or other visible abnormalities. Next comes auscultation because this is an abdominal assessment. Listen to the bowel sounds before percussion or palpation. Next, perform percussion as indicated, assessing patterns of tympany and dullness. Finally, perform palpation gently and systematically, assessing for tenderness and other abnormalities. But remember something very important. If your assessment reveals signs of instability or a possible surgical emergency, routine assessment is no longer your only priority. The patient's safety and appropriate escalation of care become the priority. This is exactly how NCLEX moves from medical terminology into clinical judgment. Let's finish with a quick review. S means subjective spoken by the patient. O means objective observed or measured. For the physical examination techniques. Inspection means look. Palpation means touch. Percussion means tap. Auscultation means listen. For the traditional general assessment sequence, remember. IPPA. Inspection, palpation, percussion, auscultation. For the abdomen, remember. IAPP. Inspection, auscultation, percussion, palpation. And finally, don't memorize the phrase, always assess first, without thinking about the patient's condition. Use clinical judgment. If the patient is stable, assessment often comes before intervention. But if there is an immediate life-threatening problem, do not delay life-saving action. The goal of NCLEX-RN preparation is not simply to memorize medical words. You need to connect the term, the meaning, the patient finding, the nursing significance, the priority, and the correct nursing action. Thank you for watching. In the next lesson, we'll continue building the medical terminology and clinical judgment skills you need for the NCLEX-RN.